When you think of bones, think of that prefix osteo, such as osteoclast, osteoblast. Maybe you've never heard of these guys, but they're busy in your body every minute of your life. Let's look at the osteoblasts. I call them the good guys, because they're going to secrete different kinds of protein fibers, such as elastin and collagen, and this gives bone its flexibility. That way, if we bump into that hard table, our bones don't shatter. They bend a little bit. The calcium salts are there for hardness, but the fibers protect us from shattering. The formation of bone is due to many things, such as pressure on the bone or tension, such as when you're lifting a weight, hormones including estrogen, androgen, thyroid hormone. In this way, let's say you carry something one arm every day, that the bones in that arm will become a little thicker than the arm you're not using. So the skeleton is very responsive to all of these things, especially when we're young. We're depositing these calcium salts into this wonderful matrix of fibers, and that's what we want to do. It's like a bank account. We want to build it up when we're young. Problem with the osteoblasts is as they deposit this bony matrix, they're isolating themselves. It'd be like if you were painting a room and you end up in the corner and you have nowhere to go because all the floor is wet. Well, that's what happens to the osteoblasts. They eventually end up in these little cave-like structures called lacunae for many of them. And now they're called osteocytes because they're no longer depositing bone. I mean, they're alive, but they don't really have a job anymore. They're kept alive through these tiny canals that are called canaliculi. And through these channels, glucose and other nutrients and oxygen are sent to the osteocytes, keep them going. And also wastes are removed. Because remember, there's a hardened, basically dead layer of bony matrix that's surrounding them. The source of all this nutrient is the central canal. And around that central canal are rings of the osteon, the bony unit. Well, the osteoclasts sometimes step in if our levels of blood minerals are low. We need calcium, phosphorus, magnesium, potassium. We need other nutrients in the blood to survive. Okay, we can't even contract a muscle unless there's calcium in our bloodstream. And so let's say we haven't had any in our diet, and our body says, hey, I'm going to have to pull some off of this bone. Now, the bone begins as a periosteum, and when we're very young, this is the fibrous layer that's going to stimulate the formation of bone. So first, we are really cartilaginous. That's why sometimes there's a car accident, and the children in the car, not just because they're in the back seat, but because their bones have so much cartilage that they tend not to have as many fractures. They're more likely to bend than an adult. Now, GH, human growth hormone, is what maintains the epiphyseal plates. And if you take a look at the diagram on the far right, you'll see the X-ray. The epiphysis is the region that has cartilage, and that's where bone elongation is going to occur. But as we reach our late teens, the osteoblasts are going to slowly infiltrate that little plate, it's called, and we stop growing. I mentioned bone remodeling earlier, and it involves many hormones. One of them is PTH, or parathyroid hormone. And this is the one we don't want because this initiates the osteoclasts. Now, if you're getting confused, think of when you're in school, and a grade of B is better than a grade of C. Osteoblasts are the ones depositing bone. I like them. Osteoclasts are going to break down bone and release it into the bloodstream. Once we have high concentrations of calcium and mineral salts in the bloodstream, then we can turn off that osteoclast activity, which is what we want. Take a look at this diagram. It's not as complex as it looks. We start at the top, low calcium concentration in the blood, PTH being released, and the osteoclasts are going to pull calcium and other salts from the bone until we have enough in the bloodstream. And then calcitonin, you notice I circle these with a blue. The PTH is the on switch, calcitonin is the off switch. So we have a negative feedback loop. Everything's going to stabilize. Osteoblasts go back to work, and this is what we want. Now joints, there's many different types. The ones most people are familiar with are the synovial ones. And the knee, the hip, the shoulder, the spine, each has a specific movement. Now around these joints of the body is a capsule of cartilage that's going to cover some of the ends of the bones and the ligaments. Oh, there's a ball and socket going on there. Many other kinds, hinge joints. If you look at the diagram below, you'll see an x-ray of, you can't see the synovial membrane, but you'll see a space between the tibia and the femur there. And that indicates where we have a lot of these tissues, the membrane and the fluids that are going to slide past each other and keep the ends of the bones from rubbing together. A cartilaginous joint is a little different. It has mostly a hyaline cartilage and some fibrocartilage, very dense tissue. It has limited movement, but it's still very important. Think of the intervertebral discs of the spine. Very important. Or that fibrous part of the sternum that connects the ribs to the sternum. A fibrous joint may not even seem like a joint because there's very little movement. Think of the sockets of the teeth. That's a joint between the tooth and the sulcus. And how about the plates of the skull? When we were very young, a fetus, we have these fontanelle plates that are going to slide past each other during birth, thank goodness, so that it eases the mother's pain. And then later on, this soft spot and these loose articulating plates harden. And as we get really old, you can't even see the sutures anymore. So we go from having this mobile head to like a rock hard head, I suppose. Osteoporosis is when the calcium concentration drops. And I've been talking about this, and I mentioned PTH. But let's get on to this story in the next slide.